Catholic Relief Services, CRS, was founded in 1943 by the U.S. Conference of Catholic Bishops to assist poor and disadvantaged people overseas to alleviate human suffering, advance for human development, and foster charity and justice in the world. CRS seeks to capitalize on its strategic advantages as a faith-based organization. CRS programs assist people regardless of creed, ethnicity, or nationality. CRS has been supporting orphans and vulnerable children, OVCs, in Kenya since the early 1990s and is currently implementing 3 OVC programs, that is, the President's Emergency Plan for AIDS Relief, PEPFAR, a funded program implemented in Coast and Nyanza provinces and supporting 37,500 OVCs. The Children Behind Project, TCB, implemented in Nyanza province and serving 19,000 OVCs. The AIDS Population and Health Integrated Assistance, Afya Plus, in Rift Valley, a 5-year project funded by the U.S. Agency for International Development, USAID. The Afya Plus Rift Valley Consortium is led by Family Health International, and CRS is responsible for the OVC component. The Kenya government, through the National Plan of Action for Orphans and Vulnerable Children, has outlined strategies to address orphans and vulnerable children. These strategies include reducing deaths due to AIDS, enhancing support to OVC, and support of safety nets such as cash transfer. With funding from the United States government, CRS is supporting the government effort by implementing various OVC projects in Kenya, including the PEPFAR-funded Track 1 OVC program in Coast and Nyanza provinces. The 3 implementing partners of the project are Homa Hills Development Organization, Diocese of Homa Bay, and Archdiocese of Mombasa, with the objective of increasing the capacities of communities, families, and orphans to respond to the needs of OVC and their families, as well as increasing the institutional capacity of the CRS partners to deliver high-quality and sustainable OVC outcomes. The PEPFAR program comprises of various implemented components, that is, education and vocational training, healthcare, HIV prevention, food and nutrition, child protection, psychosocial support, economic empowerment, shelter, and care. The education and vocational training services offered through the program aims at providing children with a safe, structured environment, emotional support and supervision of adults, and the opportunity to learn how to interact with other children to develop social networks.
Kwa shule hizi uniform huyu mtoto amevaa, hiyo ni ya CRS, wamegawiwa. Sasa kuna levies kama tuition fee, examination fee ya nursery levy na sanitary towels, hiyo ina provide na CRS ya Homa Hills.
One of the things with the CRS, there are limited spaces for the OVCs to join school. There are some who have not been able to go to secondary, which has been very expensive for them. The program has come in and sponsored the students to get onto vocational training, like the one in Mabati.
What we are seeing is the education levels in this area are very poor. Almost half of our students are Class A dropouts. Yeah? And even if they finish Form 4, they don't have the grades necessary to go for higher education, say for crafts or for diploma or for degree. Majority of them don't get those grades. And so then we said, let us go for the DIT courses, yeah? Directorate of Industrial Training. They are basic, even school dropouts can do these courses.
In view of this, the 3 implementing partners are engaged in supporting OVCs by removing barriers hindering access to education.
And so far the results have been good. We have obtained almost 95% and above of our students have passed. Then we also keep track of where they get employed, the first place of employment. No?
Need for healthcare is high among the OVCs. To meet their need, the program has put in place an elaborate system to ensure that OVCs and caregivers have unlimited access to health services through the healthcare component.
We have a defined referral system so that when an OVC or a caregiver or a community health worker is sick, they're being referred to the local dispensaries, from local dispensaries to health facilities, from health facilities, if the disease is not managed by the health facility, they move on to district hospital, who may give further referrals to the provincial and later national hospitals.
HIV/AIDS prevention is a priority of this program, which partners with the Ministry of Health Facilities to provide VCT outreaches. The program makes use of family fun days, school meetings, and chief barazas, among others, to reach their target groups. The program also led to the improvement of nutrition status of OVCs, caregivers, and guardians through nutrition education and increased food security as one of the core values to the recipients.
Pia wanatusaidia kwa kulisha watoto. Wengine wanalisha watoto lakini hawajui namna ya kupika chakula. Wengine wanapika chakula kwa dakika chache, hasa kwa dakika watoto wanakuwa na ugonjwa.
Kama wakati wa kulima wanatuprovide na seeds, yani maize na green yams. Ile inaitwa pojo.
The 3 local implementing partners employ various strategies to ensure OVC households access proper nutrition and have enough food as one of the basic needs.
That there is some improvement on the basic knowledge of the health of the children and the care, which to us as children officers we feel is very necessary.
As a way of encouraging food production and training future farmers, CRS, through local implementing partners, has initiated the Junior Farmer Field School, that is JFFS, organized in primary schools to provide skills and knowledge on farming and food to OVC.
We plant vegetable, and this vegetable is sold, especially to the teachers. And at the same time, some of them carry some home for their use at home.
Kilimo bila madawa ama bila pembejeo huwezi kuwa utafaidi. Maana ukipanda hiyo tomato lazima uwe na dawa, uwe na mbolea. Kwa hivyo hili shirika la CRS limeweza kupatia hivyo pembejeo na wanafunzi wamefurahia sana.
Apart from farming, component of life skills is integrated in the JFFS club, where members are trained in other topics including communication skills, household management, self-care, HIV/AIDS and STI prevention, and information regarding drug abuse. Child protection is also one of the key components in the program. It ensures that children are protected from different types of abuse, including sexual abuse and child labor.
I took the initiative since last year to make sure that these children are safe from exploitation. Na nimekuwa forward hizo case polisi, naenda kwa prosecution kotini, na kufikia sasa I have a number of cases ambazo wamechukuliwa hatua. Wengine wamefungwa 10 years, 15 years, na kuna wengine wamefungwa 30 years. Kwa hivyo children's problems about defilements, we are very serious on that issue.
This is achieved by continuously creating awareness to OVCs, caregivers, guardians and members of the community on child and human rights in general through community meetings, area advisory committees, AAC, at all levels, and other stakeholders forums. In addition, the program ensures that birth registration and identification certificates, which are necessary for long-term access to education, healthcare and other social services, are availed to the needy.
They collect forms from the parents, from the fields. Then they bring the forms to us for verification. We check if all the documents are correct. Then we process the birth certificates for the children. And we've done that actually for a long time, since last year.
The program has also supported the establishment of support groups in the communities where they are working through psychosocial support component.
The OVCs, we are taking care of them. We are visiting these people thrice a month. And if their need arises, we could visit, maybe we can even reach them almost every day if their need arises. But if there is no any agency, we do visit these people thrice a month.
At the same time, we always have guidance and counseling to all the pupils within the schools that we work with. We have actually done counseling to the 27 schools so far from beginning July up to this moment, with the extension of OVC Track 1.
Support groups have provided an opportunity for guardians and caregivers facing similar challenges to meet and encourage each other. CRS also rolled out the in-charge training, where it trained project staff who then trained social workers and community health workers, CHWs, who then rolled it to schools and the communities. In-charge training is a participatory learning methodology developed by CRS to provide HIV protection skills to students. Considering many OVCs, caregivers and their guardians live under extreme poverty and are struggling to afford basic necessities such as food, clothing, school fees, medical bills, and decent shelter, the need for the economic empowerment component in the program was realized. The program has been addressing the issue of access to credit by enabling OVCs, caregivers, guardians, and CHWs an opportunity to participate in community-based loan schemes that enable them to borrow and lend money to each other.
Through CRS, we have rolled out what we call microfinance, what we call saving and internal learning communities. This is SILK program which has been rolled out. Most OVCs have formed themselves as youth groups, or even through their people who support them, like the very old caregivers. They are now able to testify the major inroads they have made in economic strengthening.
Tukirudi kwa SILK tunafaidika, tunachanga pesa na tunagawanya loan, na hiyo loan inatusaidia kwa kufanya biashara. Sasa lazima mtu afungue akili ndio aone vile anaweza ajitegemea kwa hiyo loan amepata. Nikifika wakati unarudisha na faida.
Kama hivyo ambavyo nimekuja hapa nikapewa ile mabati peke yake na misumari. Pesa ya fundi ikawa hakuna, pesa ya kununua miti ikawa sina. Sasa nikaenda kwa hiyo siliki, nikaenda kuchukua pesa, kanunua miti, nikapata pesa ya fundi, nyumba ikajengwa.
OVCs, caregivers, and guardians living in dilapidated houses are households vulnerable to the elements of living in poor conditions and subsequently ill health. Shelter and Care component under the program has been renovating such households by mobilized communities to provide labor and CRS to provide roofing materials since 2004. Ruth Adoyo and Benjamin Adero of Homa Bay, both children heading the household, and Mzee Gaha Kengalugo in Bamba Parish are examples of this initiative beneficiaries. The program also ensures that the children are under care of an adult person who is able to watch over them and liaise with the CHWs and social workers, reporting on progress should children need any special attention. Capacity building has also been greatly achieved in this program.
CRS has helped us to roll out training. We have held series of training with CHWs. They know how to assess our OVCs when they are sick. How should they report? When should be the feedback? So they give monthly reports on the status of these people. And as a result, that information sharing has empowered us, because from the data, we are able to learn more, to verify, and even to fast track what is going on the ground. Again, in terms of empowerment, in terms of our organization as a structure, CRS has been able to train our board, because in most organizations, the board is never thought of. So it is not only the board, but even management and staff. We have held a series of trainings.
Tumepata mafunzo kama stigma reduction through now the Catholic Relief Services. Tumefundishwa jinsi ya kupunguza unyanyapaa. Tukaleta mafunzo kwa our community health workers ambao pia peleka kwa ground pale kwa guardians. Pia tumekuwa na mikutano na guardians kuelezea kuhusu mambo ya unyanyapaa. Tumepata mafunzo pia ya SILC, Saving Internal Lending Communities.
In community mobilization, all projects have been involving communities through sensitization meetings to ensure ownership of the activities at all levels. Program staff have been participating in meetings and barazas organized by the local administration, that is, the district officers and chiefs. Impact of the program has been felt by the beneficiaries in all the 3 areas covered by CRS since the implementation of the project in about 6 years.
Nimenisaidia tangu nikuwa class 8, wakanisaidia na uniform, chakula, mpaka nikamaliza class 8, wakanipeleka college ya textile technology. Pia hapo pia wakanisaidia na uniform, chakula, baadaye nilipomaliza wakanisaidia na machine.
And for the lessons learned, the beneficiaries and stakeholders perceived the services which they were receiving were of sufficient importance and value that they were willing to assume full responsibility and ownership for them even after the closure of the project.
Unajua CRS hata kama inaondoka tunalia kabisa, lakini amewacha sisi na silk.
The program also encourages trained OVCs to be good role models to others in their community and are used to disseminate HIV and AIDS messages among young people in the community.
The concern of the OVCs who are already in key areas are asking, we are hearing the project now is going. What shall we do? There are always those fears of the unknown. So we are putting things in place